Autism is often misunderstood, not just by the public, but sometimes even by those trying to help. What if we told you that seeing autism through a clinical lens could change everything from how we support individuals to how we reshape society's mindset? What does autism really look like from a clinical perspective? In this insightful video, we explore how professionals understand autism beyond stereotypes and into real, research-based insights. Learn what clinicians look for, how early intervention helps, and why informed compassion matters more than ever. Understanding autism through a clinical lens. What professionals know: autism spectrum disorder, often simply referred to as autism, is a complex neurodevelopmental condition that impacts how individuals perceive the world, communicate, and form relationships. While society's understanding of autism has grown in recent years, much of the deeper clinical knowledge remains behind professional doors. This script seeks to bridge that gap, offering insight into how clinicians, therapists, and researchers understand autism and why this knowledge matters to everyone. The clinical understanding of autism. From a clinical perspective, autism is not a disease, it is a spectrum of neurological differences. Professionals understand autism as a condition that presents with varied strengths and challenges, primarily in three key areas: social communication, repetitive behaviors or interests, and sensory processing. Clinicians recognize that no two individuals with autism are exactly alike. Some may be highly verbal with strong cognitive abilities, while others may be nonverbal and require substantial support. This is why autism is referred to as a spectrum, because of the wide range of expressions and experiences associated with the condition. In clinical practice, professionals often rely on the criteria to formally diagnose autism. These criteria focus on persistent difficulties in social interaction, challenges in verbal and nonverbal communication, and patterns of restrictive, repetitive behaviors. However, the clinical view is not just about checking boxes. It is about observing how these patterns impact an individual's daily life, development, and ability to thrive in their environment. The importance of a holistic assessment. Professionals know that diagnosing autism is a process, not a one-time event. A comprehensive evaluation typically includes input from a multidisciplinary team: psychologists, speech-language pathologists, occupational therapists, educators, and often medical professionals. These experts look at developmental history, behavior patterns, communication skills, sensory responses, and adaptive functioning. Importantly, professionals also recognize that autism often coexists with other conditions: anxiety, ADHD, learning disabilities, and sensory processing disorders are just a few examples. A clinical lens allows providers to identify these overlapping needs and design more effective, individualized intervention plans. The goal is never to label someone for the sake of a label. It is to provide clarity, support, and direction for care. A clinical diagnosis opens the door to resources, services, and understanding that can dramatically improve quality of life for both the individual and their family. Beyond diagnoses, what treatment looks like. One of the most critical things professionals understand about autism is that early and tailored intervention makes a real difference. Therapies aren't aimed at curing autism but at supporting development, reducing distress, and building skills that help individuals lead fulfilling lives. Interventions might include speech and language therapy to support communication, occupational therapy to build daily living and motor skills, applied behavior analysis to encourage positive behaviors and reduce harmful ones, play therapy or social skills groups to enhance interaction and emotional growth, parent coaching to empower families with tools to support their child. Clinicians also advocate for person-centered care, meaning interventions are aligned with the goals, preferences, and strengths of the individual, not just their challenges. A shift toward modern clinical practice is shifting toward a more inclusive and affirming view of autism. The neurodiversity movement, which many professionals now embrace, reframes autism not as a disorder to be fixed, but as a natural variation of the human brain. Through this lens, clinicians encourage society to appreciate the unique perspectives autistic individuals bring, whether it's a different way of thinking, a passion for detail, or a unique sensory experience of the world, autism adds richness to human diversity. Professionals increasingly work not only to support autistic individuals, but also to educate others, reduce stigma, and create inclusive environments, whether in schools, workplaces, or public spaces. What professionals want you to know? If there's one thing professionals agree on, it's that understanding leads to compassion. When we look at autism clinically, we see not just symptoms or behaviors, we see a whole person with potential, resilience, and value. Here's what many professionals wish more people knew. Early signs aren't always obvious, and every child develops at their own pace. Support at any age can make a difference, not just in early childhood. Autistic adults, matatuthi, are often overlooked, but deserve the same support and dignity. Families need empathy and resources, not judgment. Autism is lifelong, but so is growth, learning, and the ability to live a meaningful life. Bridging clinical insight with everyday understanding. When we understand autism through a clinical lens, we gain more than just scientific insight. We gain the tools to build bridges. We learn how to support development, advocate for inclusion, and celebrate neurodiversity with informed compassion. The professionals working in this space aren't just diagnosing and treating, they're listening, learning, and evolving alongside the individuals and families they serve. So whether you're a parent, teacher, healthcare provider, or curious learner, remember this: knowledge is powerful, but compassion is transformative. And when we combine both, we create a world where autistic individuals are not only accepted but truly embraced.